Welcome. My name is Sandro Galea. I serve as Dean of the WashU School of Public Health, and welcome to Public Health Ideas. These conversations aim to highlight work that advances the science of health. Today, I have the privilege of speaking with Professor Hillary Anger Elfenbein. She is the John K. Wallace Jr. and the Ellen A. Wallace Distinguished Professor and Professor of Organizational Behavior at WashU's Olin School of Business. She also has secondary faculty appointments at the WashU Bursky School of Public Health and in the Department of Psychological and Brain Sciences. I'm delighted to be talking with her today about the intersection of emotion and the aspirations of public health. Hillary, welcome.
Thanks. It's a delight to be here.
So in your work, you focus on negotiation. Let's just dive right in. The role of personality and emotion in the workplace and emotional intelligence. How did you become interested in this?
Well, in the business school, as a psychologist, I teach classes like negotiations and leadership that are basically the psychology classes that the MBAs don't think they need until they realize it's the most important thing they do in an MBA. And so negotiations is teaching it. I'm endlessly fascinated by it. And one thing that struck me is that in the research on negotiations, there's this assumption of the rational actor, right? This is all coming out of economics, and this idea that people make decisions based on calculations that are objective, and that is how they behave. And I think you can tell by the way I'm saying it. That's not what the research literature looks like today.
Yes, you're highlighting the lead. Yes.
So that's where it started. But there's been this mythology in that area that personality doesn't matter. And if I could have had a second career, it would have been as a forensic psychologist. I like to walk in a room and say, why are things here the way they are? And there's a mystery and I want to solve it. And I looked at that and said, how could personality not matter in negotiations? And interestingly, faculty who teach negotiations all believe it does because we give our students personality tests and give them feedback. So somehow there was this mismatch. And I thought, well, what's wrong? So I thought, well, I'm going to read the research that shows it doesn't matter. And these are people citing people who cited a book chapter published when I was in preschool.
Oh, interesting.
That had maybe 8 articles and maybe 12 articles that it reviewed. And so I thought, well, I want to solve this mystery by pretending this question's never been asked. And what methods would you use and what would you try? And actually, personality matters quite a lot. It matters not just for objective outcomes. And typically, the studies we do involve simulations, and the faculty member gets an objective score in points. But they also matter tremendously in how people feel coming out of the negotiation. And that has also been a mythology. Oh, how you feel doesn't matter. It's just noise. It's just irrational. But I've had a stream of research that my colleague, Jared Curhan at MIT, and I have put forward called subjective value. And the idea there is that we measured all the things people care about in a negotiation other than the objective terms. And we mapped out that actually the feelings you come out of a negotiation with matter a lot, and they predict all kinds of things. They predict people's working relationships, repeat business, willingness to employ each other. And actually in the real world settings, they matter more than actually how well you did financially. In terms of, we had students real world job negotiations for the jobs they were taking out of the program. And a year later, their job satisfaction matched much more how they felt coming out of the negotiation than their actual salary mattered, even for their satisfaction with compensation. And so I feel really good about approaching this kind of topic from a very empirical, data-driven basis, because when people talk about emotions, they think, it's squishy, and you're just, and no, I want to put numbers on stuff. I want to collect data, and I want to show empirically that actually emotion matters tremendously in settings where it has been looked down upon.
So let's now try to think about how to apply this to public health. So for public health, we collect data, and the idea is, I think we understand this, we collect data to inform often policy or program that then aim to improve the health of the public. And I think we do have a bit of this notion that you describe in The Economist, that if we get the data right and it's clear that what should be done, we're going to act as a society and good will come of it. And I don't think we think enough about emotion and people's psychology in this. So teach me how we should think about this in public health. How should we think about emotions as they intersect with our data, as they lead to what we're trying to do to create healthier populations?
Absolutely. Well, first, I would say that in those scenarios that the economic incentives matter. I will say I'm married to an economist. I'm not. If I make fun of that rational theory, I do come home to it and respect it a lot. But I think in those situations, a lot of what's going on is that people aren't mapping the incentive structure of the individual. So you might have data that shows this is how this should happen and that, but the people who are implementing that have their own, what economists would call utility function. Mm-hmm. And we don't always think about, okay, we know what would be ideal for public health. How does each actor who's implementing this have a reason to go along with this expertise and data, and how much would they be in a position where they'd want to block it or be neutral? So first, I would say there is still a lot of economic, rational analysis that could help us move forward with implementing public health. But the other thing I would say is that there's this Western myth of emotion and rational systems being separate. And the best research now about emotion talks about the intersection. So it's hard to make decisions in the absence of emotion. There are these case studies of people who've had brain injuries, and in particular brain injuries of emotional centers. And these are people who seem perfectly fine, but they can't make any decisions. And they'll have a decision, they'll say, well, these are the pluses, these are the minuses, and then they just stop there. So we'll make a decision. It's that emotional center is actually motivating us, pushing us forward. And the word emotion comes from the same root as motion. It's meant to move us forward. And if all you have is rationality, there's no momentum, there's no impetus. So I would say that what we think of as rational actually you can't act without that last bit. But I would also say that there are so many definitions of emotion, and all of them, if you really pick them apart, are tautological in some way. Yeah. But the one that I think is best respected now within academic circles is what's called appraisal theory. And appraisal theory is that our emotions are actually a real quick and dirty analysis of our world around us. So we're constantly asking ourselves, everything that happens, is it good for me, bad for me? Am I surprised? Am I not? By surprise, rather, is it novel or expected? Who's at fault, right? So we played the blame game, right? What's the difference between, guilt, I think I caused something, anger, I think someone else caused something, fear, I'm not sure, and that in some sense, we think our way into our emotions in a way people don't realize because it's so practiced. It's something that we have done so many times we don't even think about it. But I think you can see that the truth of that definition when the process stands still. So sometimes you don't know whether to laugh or cry. Well, why not? Because you don't know whether what happened is good or bad. And so you actually need to analyze the world around you and think about the world around you, even just to know how to feel. And so that I would say to that well, how do we make these decisions around emotion? Well, I think we can't not make them without emotion.
So talk us through another aspect of something that you do a lot of work on, emotional intelligence. So define it for us, and how does understanding emotional intelligence then contribute to this act of generating action, moving us forward?
So there have been theories over the last generation about many multiple intelligences, and they all come from the definition of intelligence that's been accepted for maybe over 75 years being applied to different domains. So, and actually I thought I really want to get the definition of IQ right to read it to you, so I'm going to share this. This is from David Weschler. Intelligence is the aggregate or global capacity of an individual to act purposefully, to think rationally, and to deal effectively with his or her environment. And so that gets applied to mathematical reasoning, verbal reasoning, musical intelligence, spatial reasoning. And that definition is very versatile, and you can take it and apply it to emotion. Are people able to interact effectively with their emotional environment? And now that's the definition I prefer. And in fact, this is an area where commercialization has far exceeded the research base. when Daniel Goleman published this popular book in 1995, people just exploded in doing consulting projects, paying to do assessments, and everyone who wants to sell you an assessment has a different definition.
Right.
Oddly,
but the research is not there.
Oddly, they always have 4 factors. They're never the same 4 factors. They're always 4. And what brings those together is that emotional intelligence tends to be seen in what I would call an umbrella definition. It tends to be a list of different factors, like emotion recognition is the one I've done the most work in, where it's how do you read the room? Can I detect what other people are feeling? And then there's emotional expression. Can I express myself in a way that is legible when I want to be understood? And it's kind of acting ability. There's emotion regulation of yourself. So can I keep myself calm? Can I psych myself up? Can I stay neutral? So judges, for example, there are jobs where you need to stay even-keeled. Then there's emotion regulation of other people. Can I motivate my team? Can I calm people? Can I psych people up? Then there's emotional understanding. Do I understand concepts? So if I told you, here is the situation, how would a person likely feel? And that's something, by the way, AI does very well. AI is an expert in emotional understanding. You can describe a situation and ask, how would someone feel? And it actually has the appraisal theory built in. So these are all pieces of a larger umbrella of handling your environment effectively.
So a lot of what we do is trying to think about how you bring pretty diverse groups along, diverse communities along. And you've done work around cultural differences in recognition of emotion. So guide us through that. What kind of differences do you see across sort of cultural differences around emotion, and how does understanding that help achieve the collective goal of moving things forward?
Yes. Well, this is the topic that actually got me interested in psychology at all. I had done physics and Sanskrit language in undergrad.
That's a perfect preparation for this, obviously.
And so I didn't have anything to do except I went and took a corporate job just to hang out waiting to figure out what to do with my life. And I got really taken by the kind of misunderstandings that people had with their colleagues that were strictly based on misreading their emotions. So as I like to tell the story, something amazing happened that could have only happened in the 90s. My office got moved to be next to the mailboxes. And it mattered because email existed, but attachments did not. And so people would leave each other their work products on, as I like to say, paper made from trees, and they would put it in their mailboxes. So people were constantly stopping by, and they would tell me about how their day was going. And I realized at some point, listening to other people tell me how their day was going was the most interesting part of my day. And so I started getting interested. And one of the themes in many of people's stories was that they were misreading others' emotions. So how do I know if you like my work product? Well, I'm reading your expressions. We don't often use verbal expression for things that we can more subtly express. So how do I know when it's my turn to talk in a conversation? Like, who's listening to me? If I say something, how do I know it landed? So I started realizing that was harder in global teams. That was harder across cultural boundaries. People were tripping up. They thought someone was angry at them, but that was just how emphasis looks in the culture where that person is from. They didn't notice. They missed signs that were perfectly obvious to the person expressing them. And so I went to grad school. That was what I wanted to do in my dissertation. I started out talking to faculty about, hey, I want to do work on how global teams are held back by differences in emotion. And people said, oh no, that cannot be true. Emotion is universal. Across cultures, it is a biological phenomenon that does not have cultural differences. And so, having a passport and a backpack, I was really confused by how that could be the case. So I started reading again. It was people who cite people who cite people, who in this case cited a book chapter published the year I was born. So I wasn't yet in preschool even then. And what did that say was also something that really was interpreted very differently than what it was. And what those people were saying is, you could take photographs of white people, it's important to say that, from San Francisco on a round the world tour, and people can guess what the emotion was intended better than throwing darts at a wall. So there were 6 emotions and 6 multiple choice options, and people did always better than 16.667% all around the world. But guess what? They did better in America. And then they did next in Europe, and then South America, and people from Asia did worst of all on this test. And so I looked at all that and said, wait a second, I just was looking for something to cite and move on.
Right.
But actually I had to step back and do the foundational work. And so I like to say, I'm 54 years old. I will always be best known in my career for the first thing I did the first year in grad school, overturned something published the year I was born. And for a while, I didn't have a sense of humor about it. I found that incredibly demoralizing. But now I really do.
It's okay. I think it's fine.
So you asked about public health. There's a lot of work showing that cultural match between provider and client, it predicts better outcomes in clinical settings. So therapy, in general, part of that may be trust building and understanding a person's community. I think another part of it is being able to read each other. Imagine if you're a psychotherapist and there are signals your patient is giving about their distress that are harder for you to understand, and there are signals that you're providing that are harder for them to understand. So I think one of the implications of these cultural differences is as we engage in client work, are we connecting and understanding mutually our clients as well as we can? And I think that's an argument for having a diverse health workforce. So that
can
people
understand each other better. I'm going to ask a question that diverges from the script because you got me intrigued. So when you talk about psychotherapy and the psychotherapist understanding the client's emotions and understanding also the client's body language and all that, would an implication of that be that an AI-based psychotherapist is never going to be as good as a human because the AI doesn't have a capacity, at least yet, to pick up body language? Is that true? Am I drawing the right next step?
Well, AIs actually have been trained to pick up body language. The challenge, though, is that they're being trained on models, right? All of AI, the problem is what are they being trained on? And emotion recognition, they're being trained on white faces from not necessarily San Francisco.
Right.
It could be from anywhere white faces can be found. Right. And the research already shows that people with different skin complexion are misidentified in their emotions by the AIs. So AIs, for example, for the voice, are very good at parsing all the acoustical properties of the voice and having pretty good guesses about the emotions people are feeling. And so they may, if they're programmed well with a really good training set, they may end up actually being better able to avoid the cultural biases. You can imagine ones, and
I see.
I'm cited by very weird places. I'm cited by a lot of computer science work because they're trying to figure this out. They're trying to figure out how do you get machines to know if somebody is from India, you should analyze the acoustical properties slightly differently than somebody from Zimbabwe or England or Australia. And these are I mentioned these particularly because it's all English. So I've done work where I've sampled voice actors, professional actors from 5 English-speaking countries, and even among native English speakers, there are different acoustical profiles of emotions that they're expressing, and they're mutually intelligible. Sometimes the differences are really subtle, but subtlety is still enough to throw people off. So I'll say I'm amazed by what my chatbots can do. I'm not going to be surprised if 10 years from now they are as capable of detecting body language as you or I are. In fact, they may slightly be better because you and I have to choose where we focus our attention. So I'm focusing on, we're looking at each other face to face and we're hearing each other's voice, but a lot of emotion leaks out through channels that you can't pay attention to all these channels at the same time. So posture, we're moving around and hands, and there's what's called a leakage hierarchy. So we're very able to our facial muscles are very labile, and we're very much able to control them. The voice slightly less, body language less. It's much harder to control what you do with your hands when you're focused on trying to express facially and vocally. And so a computer could actually just be looking at all of that at the same time, where you and I have to split our attention.
Well, now I'm getting self-conscious about using my hands. So, a lot of what public health aims to do in practice anyway is to negotiate policies and practices that can shape health. And I think we recognize in the field that often you're dealing with stakeholders with different value sets. So how does this conversation, what we're talking about, how does understanding emotion, help navigate those situations where you're dealing different value sets and you're trying to arrive to a place that allow you to move forward with action?
I think the first is really understanding the counterparties. And it's something people don't spend enough time doing, is asking, why is this person in the room? Imagine all those different stakeholders are in a room together. You should have a good answer, a very clear answer to why is this person in the room? What do they want out of life? What's important to them? What's deeply important to them? And then what are they going to say out? So that's their interest. And then what's their position? What are they going to say out loud is important to them? And how is that different from every other person in the room? And so first, I think in these multi-party conversations, I don't think we do a good enough job asking ourselves, like, why are they here? What do they want? What does success mean to this party and to that party? And we assume that what we want is something that maybe this person doesn't want, but we don't ask ourselves, what do they want? Because I look at public health as there's so many win-wins that are out there that we don't get to them because we're not thinking about. Well, look, we look at business and we think about businesses as being opposed to a lot of community engagement, but actually you look at what are some of their biggest expenses are health. You know, how can we actually meet them in a place where they have a win too?
So two questions. Number one, a little bit off script again. So, you studied this, you think about this, and, we know each other a little bit. So you must be very successful at your interpersonal relationships. You think about emotions, you understand people's emotions. So what's the commonest mistake that you make in misunderstanding emotions that you feel like you should know better?
I get blind spots. Like everyone else, I will sometimes focus on a channel and misread the rest of it. And it's a lot easier when you're not in the conversation. It's so much easier if you're watching other people to pick up on things. But when you're in the situation yourself, I'm thinking about what I'm going to say next. I'm not just reading somebody. I'm thinking about what am I going to say next? I'm listening to the content and focusing on the content. And now, if my husband were here, he would tell you she just sometimes really reads somebody all wrong, and it's because you're how much attention can you pay to every single thing that's going on?
Well, I'm glad that gives the rest of us some hope.
Or maybe not.
Or maybe not.
Actually, I'll say about negotiations. People ask me all the time. So my husband and I both worked together at the Olin School, and we've had, our dean who first hired me would say, "I wonder what that negotiation's like in their household." And the truth is that it's a lot easier from the outside to have some of these concepts.
Yeah.
But you have to ask yourself, how much attention do you want to pay to every single thing going on in your life? And I like to say to the students that negotiations is hard work. You should think of it more like working out than something pleasant. You're not. And the definition of a negotiation, the most accepted definition is that it's a mutual decision-making process to allocate scarce resources. Mm-hmm. Why should that be fun? And so for me, I try to figure out, when am I going to turn it on and when am I going to not? And what are things that are worth negotiating? And sometimes the most successful negotiation is the one you don't do. And
that's a good point.
Yeah.
That's a good point. Last question. So what gives you hope in the moment?
Okay, what gives me hope in this moment is I am witnessing a lot of young people entering public service. Look at, the boomers have held on too long. Gen X, my generation's just been passed over. And now you're starting to see millennials and Gen Zs just moving in and using their voices. And they plan to stick around on this earth longer than those who are in power. And they're starting to share their aspirations for a better world. I just find that so beautiful. And I just hope anyone who's listened this far in our conversation looks around and says, who are the young people entering public service and how can I support them? It's beautiful.
That is a wonderful note to end on. Hillary, thank you. Thank you for joining.
Thank you for having me.